Well, a mountain of hope is being put on the coronavirus vaccines, but will it end with your shot? Or is COVID-19 going to be an ongoing yearly threat? John Shumway put those questions to an expert. And John, this is just also new. We all have those questions.
Yeah, and it looks like your shot is certainly going to protect you for now, but it's not going to be the end of the issue. Dr. David Agus, a CBS News medical expert from the USC Keck School of Medicine, says the virus is actually calling the shots.
Virus is zagging when we zig, and that's very common in viruses. So we will need to update the vaccine at some point with some of these new spike proteins like the South African variant and the UK variant, but that's expected, and science is going to be able to zig and zag with that virus. The companies are already making the new variants and getting them ready in case we need them.
Will it become a situation where we need one every year?
Whether it be, months or 6 months, because of this South African strain, or every year or every 2 years, we don't know yet, but we'll learn more as we go.
But we all got a polio vaccine as a kid, and we've never had to get it again. What's the difference?
Well, certain vaccines elicit remarkable immune responses and can last for a lifetime. Certain viruses, when they're wiped out, and polio has been wiped out, they're not there. So when you have a lot of a virus like we do now, it's going to change all the time, and you see many variants. When you're able to wipe out a virus very quickly with a very effective vaccine, like your remarkable polio vaccine, you don't have to reprime on it, and that's good.
It gives you due respect for Dr. Jonas Salk. Now, unlike how the vaccines change for the flu almost every year, we are already seeing the vaccine changing for COVID-19, and it hasn't been a year. So stay with us. It's still a lot to be determined here, David.
Yeah, it's certainly evolving as we're talking about this. So the bottom line is we really don't know how long these vaccines that we're talking about right now are going to protect us from this, right?
Well, against the original strain of the COVID-19, the manufacturers were very confident that we were going to get at least a year out of it. But now that we've got these new strains coming up, they're just not sure. And this could end up like the flu shot. We could end up getting it every year, or who knows how soon.
All right, we will wait and see. Thanks for the info, John. We appreciate it.